Good afternoon and welcome to the Independent Sage Friday briefing, and it's an important one. Independent Sage is calling for an urgent rethink about Christmas because hospitalization rates now have increased almost to the peak we saw in April. Dr. Kit Yates will start by presenting the week's figures, and then we'll be hearing from Professor Susan Mickey, who will say a few words about Christmas before we open up to questions. Kit, you can start.
Thank you. I'll just share my screen with you. Hopefully you can all see that. I'll put it on presentation mode. Okay, so I have to say in short, this is probably the worst set of data that I've had to present so far. The situation across the country is deteriorating quite rapidly. Cases are rising almost everywhere. Hospital admissions are rising almost everywhere as well. And the tiers are not really keeping things under control, even tier 3, and we'll see that in the data. So I'm going to take you through cases first and then talk a bit about the tier system, go on to hospitalizations and then on to deaths. And then I'll touch a little bit on vaccination data and the need for a good vaccination dashboard and joined up IT systems. And then I'll just mention the science behind Christmas before I pass on to Susan to talk about our recommendations. So to talk about cases first, these are cases across the United Kingdom, number of new cases per day by reported date. Yesterday, you can see at the far right there, it's slightly cut off. We had the biggest increase. I had to increase my y-axis, my vertical axis, because we breached the 35,000 reported cases. Now, part of that was actually due to a backlog of data in Wales. Wales reported 11,000 missing cases yesterday that had been missed off the previous 4 or 5 days. But actually, even with normal reporting levels from Wales, this probably still would have been the second highest day just after this peak that we saw in the middle of the last lockdown around the 10th of November. So this is not a good situation. Cases are high and they are rising rapidly, and we're reaching record levels of recorded cases. This is a plot of the number of new confirmed cases per 100,000 people in the UK nations. So you can see that recorded cases are increasing at the moment in every nation. Again, this problem that Wales had is actually not visible here because by specimen date, which is what we're looking for here, all the 11,000 cases were correctly back allocated to the correct day that they were taken on. So this rise in Wales's cases per 100,000 is genuine. I should say this only goes up to the 14th of December because there is a lag when you are reporting by specimen date. There will be samples which were taken on the 15th, 16th and 17th which haven't been reported yet. But it's still not a good picture rising across all the nations. It's usually good to do a common sense check to make sure that actually if you look at normalizing by the number of tests that are being done, so looking at the percentage of tests which come back positive, what's happening. And actually it paints a slightly different picture. Northern Ireland is actually flatter rather than rising, but Wales and England and Scotland, you can see, are all rising. It paints a similar picture, but Northern Ireland is slightly different. This disagrees somewhat with what we're hearing from Northern Ireland, stories about ambulances queuing around the block and people waiting for 24 hours to get into some hospitals, and the fact that Northern Ireland have instituted a sustained tougher lockdown for 6 weeks from Boxing Day. So if we move on to looking at the number of new cases per 100,000 across different English regions, cases are rising now across all the regions with the possible exception of Yorkshire and the Humber. That's this purple line you can see here in amongst everything, where we've seen a slight dip, but in every other region cases are rising, and you can see now that London is really the highest case rate of all regions, but the southeast and the east are also up there, whereas the southwest is remaining low, and it's places in the north, the northeast and the northwest have now been overtaken by these regions in the south. Again, just to confirm that this is the positivity rate, so dividing by the number of cases by the number of tests. And again, you can see the same picture. So these are not an artifact of increased testing. This is real. Cases are rising everywhere, possibly with the exception of Yorkshire. So this plot I want to describe in a little bit more detail. This is drilling down a little bit further into the local authority level of cases. So this is a plot of cases per 100,000 people in all the local authority regions in England. They're ordered from left to right, from highest to lowest cases. You can see that this orange curve sort of decreases across from left to right. The orange dots are where that local authority is this week. And the grey dots, which are sort of vertically above or below the orange dots, tell you where that local authority was in terms of its case rate last week. And so the fact that the majority of the orange dots are above the grey dots suggests that cases have risen almost everywhere. And some places have seen really huge increases above 50% in a week, which is really worrying. So I'm going to use a couple of these plots to just briefly discuss the effect of the tier system. This is the same sort of plot, but it's just with the local authorities that are in tier 2. And so you can see that actually the vast majority of the local authorities in tier 2 have seen a rise in cases. There are only a very few local authorities that have actually come down under tier 2. So it suggests that tier 2 has not been effective in bringing cases under control almost everywhere. So almost everywhere has seen a rise in cases under tier 2. Looking at tier 3 now, the picture is a little bit different, but actually it's relatively similar. Tier 3 does do a better job of controlling things, as you'd expect. There are more stringent restrictions there, but actually still the vast majority of regions have seen rises. The grey dots are below the orange dots in lots of these regions. So we've seen rises over the last week. Tier 3 is our strongest set of restrictions. And actually, for me, this is probably the most worrying slide of all of the ones I'm going to present. This effectively suggests that even our toughest set of measures is not enough to slow the spread of the virus down. And with Christmas mixing on the horizon, I personally find this extremely worrying. So I'm going to, that's cases and the tier system. I'm going to talk briefly about hospitalizations now. So this is hospitalizations across England, presenting just England because actually the reporting in the different nations makes it difficult to do fair comparisons. Hospitalizations, you can see we had a dip as a result of the lockdown that we had in November, but now hospitalizations have been rising for the last couple of weeks ever since lockdown was released. And actually that reflects the fact that cases were rising even before the lockdown was released. So we're hearing more reports from across the country of hospitals nearing capacity or running out of beds, and this is going to get worse because to some extent rising hospitalizations now are locked in because cases have been rising across the country. This is a chart of hospital occupancy in England, and I've gone all the way back to the middle of March when we first started recording this data. What you can see is that we are approaching the height of this graph. We're approaching the occupancy that we saw in spring. At the moment, we're approaching 16,000 people in hospital with COVID. And it seems extremely likely, unless we take evasive action soon after Christmas, that we're going to get close to and probably exceed that April peak that we saw. In total, in the first wave, we saw about 113,000 people being admitted to hospital, and that was when we were caught unawares. And so far in this second wave, we've seen about 92,000 people hospitalized due to COVID, and that will undoubtedly rise beyond the spring number in the next couple of weeks. So this second wave is going to overtake the first wave in terms of the number of people hospitalized relatively soon. And this is the final one, hospitalizations. It's just drilling down into English regions. You can see that the hospitalizations are rising across all the different regions, with the possible exception of the Northwest, which seems to be sort of flatlining. That's this light blue curve here, but hospitalizations are rising everywhere. And I guess the message is that people have been focusing a lot on the South and the Southeast and London, but actually this is a problem everywhere across the country. Cases are rising everywhere. So this is something that I'm personally quite worried about. And then I'm going to talk briefly about deaths. So this is data from the Office for National Statistics. These are deaths registered within 28 days of a positive test across all 4 nations. So you can see blue is England and Wales combined, purple is Scotland, and yellow is Northern Ireland. So these are actually by a couple of weeks. So this latest one is the 4th of December. And so you can see that deaths have started to come down. So these are sort of the most accurate figures, but they are delayed. So it doesn't give us a good picture of what's going on now. So if I just show you the number of deaths in English hospitals within 28 days of a COVID test, this gives us a much more up-to-date picture of what we've been looking at. The data are quite noisy because there are reporting lags over the weekend. You can see drops for a couple of days every single week. But if you look at the black curve, which is the 7-day moving average of the number of deaths, then you can see that after a brief fall at the right-hand side here, we've started to see it plateauing, and actually then at the very end here starting to rise. So deaths are going up again, and they will continue to go up for several weeks because we've had cases rising and hospitalizations rising. So this again doesn't paint a very pretty picture. So the last thing I want to talk about is just to highlight an issue with potential with the data, and this is with the vaccination data. So what I'd like to start by showing you is the data from the new vaccination dashboard, but unfortunately that doesn't exist yet, so I can't show you that. For me, this feels like a huge own goal. From a public health standpoint, it's clearly going to be really important to know who's been vaccinated and how many people have been vaccinated in total. Vaccination is for me the one good news story that we have at the moment. So I'm really surprised that the government aren't making more of an effort to publicise these figures. There were some figures released 2 days ago in a tweet by Nadine Zahawi, who's the vaccine rollout minister. And he tweeted these figures suggesting that around 140,000 people have been vaccinated so far, but the figures are a little bit suspicious. So England, Northern Ireland and Scotland are all very round figures. Wales is oddly specific. It doesn't give you confidence that they're recording these in a coherent way. But we have been promised that there will be a COVID dashboard for vaccines and for vaccine rollout next week. But obviously, given that there are 2 doses, we don't need to just know vaccines administered. We also need to know total number of people who've been given both doses and who have completed the vaccination program. And that actually touches on a story that we've been hearing this week, which is about IT problems potentially causing delays in vaccination. So GPs have been forced to collect data by hand on the administration of the vaccine following failures of software programs. And we know that there are problems with the systems that record appointments not talking to the systems that records the administration of the vaccine. And clearly, because the Pfizer vaccine requires 2 doses, this is a significant problem because we need to know who's had it and to be able to recall them to have their second dose. And this is potentially going to cause significant delays in vaccinating people, but also in the rollout of the data. For me, we've known that vaccines have been on the horizon for several months now, so it's really disappointing that a functioning system for organising the process hasn't been a top priority. And I'm going to finish by just discussing a little bit of science behind Christmas, because obviously this is our last briefing before Christmas, and my colleague Susan Mickey is going to take you through a bit more of the ideas about how to have a safe Christmas. But I wanted to just say a little bit about what's been done in terms of the modelling. So SAGE warned last week that infections could easily double over the course of the Christmas break. Researchers in Bristol have suggested that if all households in the UK decided to pair up with one another, that would increase the reproduction number within the household to be between 1.9 and 2.4, so significantly higher than it is now. And similarly, if all households formed a bubble with 2 other households, which they're allowed to do under the law, then that would potentially cause R to skyrocket to be between 2.8 and 3.5, so a potentially huge increase. We know that research suggests that COVID spreads most easily in stuffy rooms where people gather for long periods of time. I don't know about you, but that sounds very much like the Christmases that we have in my family in the past. So the being safe at Christmas is going to be really important. So I'll just summarise by saying that it looks like case numbers are rising across almost all regions in England and in the 4 nations. The tier 2 is clearly not enough to slow spread almost anywhere. Tier 3 is still not enough to slow spread down in even the majority of regions. It's not enough, even our toughest level of restrictions. Hospitalizations are also rising everywhere as a result of the fact that cases have been rising. and weekly deaths are still high, although they've fallen a little bit. They're also beginning to increase. So the other 2 points are that vaccination, we need to have a joined up system if we're going to roll this out in a coherent and safe way, and that at Christmas, as we're going to emphasise in a second, we're going to need to take measures to protect ourselves and our communities and our loved ones this Christmas. So I'll stop sharing my screen and I'll hand over to Alice. Thank you.
Thank you very much for those rather sobering statistics, Kit. Now it's time for Professor Susan Mickey to speak to us a little bit more about Christmas. Susan.
Thank you. Can you see the slide all right?
No, not yet.
Not yet, no. Have you shared your screen?
Aha.
Hopefully that will appear.
I think
I can do it if you want, Susan.
yes.
Have you got the slides there, Kit?
Yeah. Can you all see that?
Yes. Are you happy to speak to those slides then, Susan?
Thank you very much.
Thank
Thanks, Kit. Well, despite the dire situation that we're in, that we've just heard about, the 4 nations have discussed whether or not to revise the Christmas policy with respect to COVID-19, and unfortunately have decided not to and proceed with their overall approach. We believe that the relaxation of restrictions over Christmas was a mistaken decision, given that we never got community transmission down to a low enough level, and we don't have a well-functioning test, trace and isolate system. So the situation that we're now in was completely predictable. And Independent Sage has warned of the serious consequences that would result from gatherings across both households, but also communities. So what we're now doing is strongly advising the people of the UK to follow the advice that we produced last week on how to keep themselves safe over Christmas. The next few months will be critical, and we need to keep ourselves and our communities safe while the vaccination programme is rolled out. So this is a very nice schematic based on the 3 points of how to reduce COVID risk at Christmas that we produced last week. So the first is that just because we can doesn't mean we should. So really to consider either having no guests this Christmas or reducing them, or better still, wait until next spring or even next summer when we can celebrate and have holidays with families and loved ones safely. Secondly, really think outdoors, not indoors. The data is very, very clear that meeting up outdoors is hugely more safe than meeting up indoors. So try and meet up outside if you feel you have to meet up with others. If you're indoors, then open windows, doors, make sure vents are open. Just make sure that whatever the air is inside a room is being circulated regularly. And the best way of actually approaching this is to consider that somebody in your midst is infectious. There's a tendency to think that those that we're familiar with, we're close to, are much less risky than others. That's not true. So that's going to be the safest way of approaching it. And finally, safe, not sorry. Self-isolate for 10 days before you meet up with people. And when you do, keep socially distanced. Okay, next one. Now, 3 weeks ago, SAGE, and that is the Government Scientific Advisory Group in Emergencies, published an excellent paper on reducing risks with Christmas in mind, but generalizing it to all social interactions. So again, they said the safest interactions are online or outdoors, and very clearly social interactions in the home increase the risk of infection. This paper produced 10 principles for reducing household transmission during social interactions, plus a household plan for putting those 10 principles into practice. So something very practical. Because of time, I'm not going to go through the 10 principles, but here is the link to the paper for anybody who'd like to follow up. But I will just show you what the the household plan looks like. So first of all, who should do it? Everybody who's planning on any social interaction with people from other households. What should it cover? Really think about who you'll meet. Do you have to meet all the people you thought you would meet? We're calling this rethinking. Whatever your plans are, it's not too late to change them given the seriousness of the situation. How often will you meet? I know Nicola Sturgeon suggested just meet on one day. What setting and for how long each time? The longer you are with people, the more likely you are to get infected. And the kind of things that it's talking about, again, maximizing spacing between people, ventilation, using face masks where possible, and not forgetting to make sure hands, objects and surfaces are regularly cleaned. Have sanitizer right by the front door for anybody who comes into the house. Have particular places where anybody from who's not in your household sit, and you sit further away from them. And just plan your activities so that you limit just to those that you have a higher risk of spreading the virus. Next. So this is the first 4 steps of the household plan. I won't go through it all, but it's arranging to discuss with people, because actually this is quite a difficult thing to negotiate with people. And I think we all have to give permission for everybody to say, you know what, given the current figures that I've just heard, I actually don't feel that comfortable. I'm not going to be able to relax. Let's wait and get together when it's safer. So then going through the different steps about who you'll miss, who you'll meet up with, what setting, etc. And the final slide are the final steps. Again, discussing the activity, making sure that everybody is signed up to it, and making sure that you're properly prepared if anybody is coming into your house, exactly how you're going to do it. You know, people share or touch the same surfaces. How are you going to make sure those are disinfected after people have touched them? So I really commend this document and this plan to you. It's online. Do go and have a look. Thanks very much.
Thank you very much indeed, Susan. And now we're going to open up to some questions then. So our first question comes from Kevin Courtney, who is the Joint General Secretary of the NEU, the National Education Union. Kevin, what's your question?
Thank you very much, Alice. And I'd like to thank all of you for the work you're doing as Independent Sage. I think it's really important in helping our society get through this. Just on the question of what Susan just said, I think self-isolation for 10 days before Christmas was some part of why schools were considering going online this last week, but the government was very clear that they shouldn't. But my question is about the recently announced proposals for mass testing in schools. So the government is very concerned about the high levels of pupil absence this term, as is the NEU. And we're also concerned about the role played by school and college communities in the spread of the virus. We've seen in today's ONS figures large increases in secondary age and primary age pupils. The government announced this week it's proposing to introduce a mass testing regime from January the 4th. We've been calling for a mass testing regime of asymptomatic people, but the last minute nature of this is an issue for us. They say all secondary school students will be tested twice in the first week of January. And thereafter, the proposal is that school staff will be tested weekly, and that school students, secondary school students, who are close contacts of a child or somebody with a positive PCR test will then be tested daily for 7 days as an alternative to self-isolation. The test used would be the lateral flow test. The intention seems to be that the test will be carried out by school staff or volunteers. So we do have worries, ourselves and the other unions, about the practicalities of finding and training staff before January the 4th. But we have other questions as well that are the ones that I'd like to focus on. The pilots for this had the testing carried out by by the Army. And then those pilots were assessed by Porton Down to assess the clinical equivalence of the serial testing compared with self-isolation. But as we understand it, there hasn't been any piloting or assessment of tests carried out by school staff or volunteers. So my question is, do you think that the evidence supports the immediate wide-scale implementation of this testing approach administered by volunteers or school staff as an alternative to isolating close contacts? Do you think this testing regime is likely to reduce coronavirus infection amongst staff and pupils? What steps do you think should be taken before we attempt this programme? What recommendations would you make to improve this proposed approach?
Thank you very much for not one question, Kevin, but a whole bunch of questions there. So you've broken my first rule, which I didn't actually iterate at the beginning, which is you're only allowed one question, but they're all extremely good questions. And I wonder if Professor Deenan Pillay would like to start with these questions, but I imagine quite a few of the panel will have something to say here. Deenan.
Thanks, Alice, and thanks, Kevin. A really, really important set of questions. I'll limit my answers to just some comments about the lateral flow tests and let others come in afterwards. The first and the most important thing is that a test or mass testing as a concept is useless unless there's a real focus on what we do with those results that come out, whether those tests are negative or positive. And it is really disappointing, as I heard an education minister on the radio this morning, just talking about mass testing being the solution. It is not. Testing is only as good as what comes afterwards. So it's the environment in which it is undertaken that is the critical thing. Just something on lateral flow tests that you quite rightly characterize. They are easy to use in the right hands and quick. So I think there's a lot of opportunity for using them to get results back, to make rapid decisions. And clearly, if the aim here is to keep schools open, that's a positive thing. We know, as you say, in the best hands, maybe 60 to 70% sensitive. In other words, if there are 100 infected individuals and they're all tested, then 60 or 70 of those 100 will come up positive, and 30 to 40 will come up as negative. So that is a clear limitation. And as you said, the analysis from the Liverpool mass testing program was less than 50% in practice of sensitivity. So clearly, one-off testing is not very effective in terms of trying to identify people. However, I do think there are positive ways in which they can be introduced, particularly with more regular testing, whether those are twice weekly or daily, because that increases the likelihood that you will detect people who are highly infectious. But of course, the terminology and the concepts that you've quite rightly identified between mass testing, just testing children and pupils for the first week, or then testing staff and other children in contact and so on, it leads to huge complexity, to be honest. And what this calls into question is the oversight of this. Now, I would have thought the obvious oversight must be from the Director of Public Health sitting within the Health Protection Unit for the local authority that covers schools, because that is that's where the liability will stand. This is about doing testing for a disease in people in a school situation, and there are of course clinical as well as public health implications of that. And my worry is if this is done, if head teachers are to be held responsible for enacting this, using staff as volunteers and so on, it's critical that this is done under the auspices of a Director of Public Health, ideally. Thank you.
Thank you very much, Dean. And Dr. Zubaida Haque.
I don't think I'm going to be as polite as Deenan. I actually am staggered, Kevin, that teachers and the school workforce are being asked to roll out what is essentially a public health professional thing to do. It should be public health teams. It should be the 12 billion privately led test and trace team, or even the army. And it is staggering that the government have asked teachers who are supposed to be teaching. I mean, they have been struggling throughout this pandemic to do online teaching, to do teaching on site. The biggest concern here is that the Department for Education have wholly failed to support schools throughout this pandemic. You know, we've had 1 in 5 secondary school pupils off, and they haven't been given the IT support. The DFE hasn't supported schools in terms of ventilation, in terms of creating more space for learning. It's been very difficult for students to socially distance. So as Deenan said, there is no point testing unless you know what to do with the results. And I think we've seen from Liverpool that they haven't really done anything with the results because they didn't consider self-isolation. So I think the government really needs to rethink this. It is not fair to ask teachers to implement these tests, but also to risk themselves in implementing this test.
Thank you, Zubaida. Professor Martin McKee, I know that you've got concerns about accountability here.
I do. One of the things that we've got wrong all the way through, and this was something we highlighted in our very first report, was the importance of engaging with people on the ground. What we call co-creation or co-production is a fundamental principle of research. And in fact, it's one of the things that paradoxically the United Kingdom has been in the forefront of advocating in health interventions in low and middle income countries, and yet we don't do it ourselves. So these things need to be worked out with people on the ground to work out what the practicalities are. And we just seem to be making the same mistakes again and again.
Thank you very much. Professor Stephen Reischer.
If I can find the unmute button. Again, there's a general issue here, I think, which is that time and again, we get one element of a strategy being held up as the whole answer. So, of course, mass testing has got its place. And of course, mass testing is a good thing. And nobody's going to say it's not. However, if you just, as we've already heard from Deenan, do the mass testing without what comes next, then it's counterproductive. It's an infantile obsession with big numbers. But equally, it seems to me there is little point in trying to find out who is infected without asking why they get infected in the first place, and without trying to make schools safe so we get prevention rather than having to have detection and cure. And if there is a priority over the Christmas break, if there is a priority about what should be done, if there's a reset that should be done, it's to think about how to make our schools safe. And that was the focus of our briefing a couple of weeks ago and our Safe Schools report. And I would recommend to everybody to look at that because it gives very clear and very simple and very practical steps that can be taken to make schools safe places for pupils, for teachers, and the community. And that's the reset we're asking for over the Christmas break.
Thank you very much, Stephen. Dr. Talila Oni, you'd like to comment on this question as well.
Thanks. Just to pick up on Steve's point about prevention, I just want to make a small point about the importance of a joined up approach and addressing silos, because obviously schools are really important. It's important we do all that we can to keep schools open, keep them safe, etc. But schools are microcosms and exist within broader communities. So if we talk about testing within schools, that surely has to be linked to contact tracing within the broader community, because students don't exist de novo within schools and only within schools. So if you're identifying cases within schools, yes, it's important to identify potential exposure within the schools for students and teachers, but also the importance of a functioning contact tracing system to understand the potential exposure outside of school in the wider community, and to effectively identify those contacts and support isolation for those contacts. So it's just really important when we talk about schools to connect it to the broader efforts to reduce community transmission.
Thank you very much, Talila. So, Kevin, I hope that answered at least some of your questions. Certainly a need for clearer lines of accountability and a more joined up approach. And that schools report that Stephen mentioned is on the website. So on the Independent Sage website are all the reports that Independent Sage has produced over the months. They're available there. And we're moving on now to another question about schools. It comes from Vix Louthian, who is the national spokesperson for education in the Green Party of England and Wales, and a secondary school teacher on the Isle of Wight. Vix.
Hi. Thank you very much. And thank you very much for everything that you've been doing. It's been really great to be a part of this afternoon. Yeah, I'm a secondary school teacher here in the Isle of Wight. I've been increasingly despairing at this government's failure to demonstrate effective leadership and support our schools and our staff and our young people in this pandemic. Our schools have been expected to stay open throughout the last long term with no support, no PPE, no social distancing, no reduced class sizes, no laptops, and no access to testing. And we're now heading into the darkest weeks of this second winter wave of the virus. We've got plenty of time in order to prepare, but I'm really concerned about our school communities. I'm asking the panel, what can be done specifically to prepare and to support our schools in reopening safely after this Christmas break?
Thank you very much, Vix, for that question. Who would like to start with that? Zubaida.
I think really, just to reiterate, Vix, as Stephen mentioned, the emphasis isn't just on keeping schools open. The emphasis should be on keeping schools safe. And we have reiterated this at Independent Sage time and time again. It's not just open schools, it's about safe schools. And in our reports, we've produced a couple of reports now. We've basically been quite prescriptive about what that requires. And that requires good ventilation in schools, because in a lot of schools, they're quite old. You can't open windows very easily. They're also in highly dense, populated, polluted areas. Teachers don't necessarily want to be opening their windows, but the government hasn't invested in that ventilation. And yet, even though the vaccine is around the corner, we are still talking, a minimum of 6 months, maybe, up to a year, where we will need a better ventilation system in schools. So the government needs to invest in that. We have also said that the government needs to create more spaces. They need to rent more spaces outside of school. And that means also more workforce, a bigger workforce, whether that's more teachers or teaching assistants, so that children can socially distance, so that there can be more teachers looking after more classes. We've also suggested that secondary school pupils wear masks in classrooms. Now, the government, as you have said, have not been prescriptive about any of this. They haven't mandated any of this, and they've wholly failed. And worse, actually, as we saw last week, even when councils have taken the decision to keep their pupils safe by keeping them outside of school so they can self-isolate before Christmas, the government had made those councils make a U-turn. So you're absolutely right. You're absolutely right. We're despairing, but there is still time for the government to turn around.
Thank you, Zubaida. Stephen, Raisha, you wanted to comment on this as well.
Just briefly, I think we made a big mistake with our report. You see, the government seems to only listen to reports if it pays the consultant £6,000 a day to produce them. And we produce this one absolutely free. You can see it on the website. It will cost them nothing, and they don't seem to want to look at that. So in future, we will charge the government £6,000 a day for all of our reports, but not the public. The public can still see them free. So it's there, and all the details are there. But I just want to make one small point, which is that to me, safe and open are not contradictions, they're interdependent. Because schools are not safe, 20% of pupils, 1 in 5, have education closed to them. They're off school. It's a disgrace, nearly 1 million children off school. And of course, as you intimated, those who are not affluent and won't have their own computers and won't have their own rooms can't study at home. And so that educational inequality is stark. Schools are being closed to many children by default through negligence, and we need safety to keep our schools open for all.
Thank you very much. I'm going to move on now to the next question, which comes from Nigel Nelson from the Sunday Mirror. Nigel. Are you there? Yes.
I am here.
Good.
I appreciate that you don't think people should meet up over Christmas, but when the PM and Chris Whitty were talking about how to go and do it, they were saying keep meetings short. What they didn't say was how short is. So does that mean it is safer just to have a 1 hour cup of tea with Granny, a 2 hour Christmas lunch, or 4 hours in the afternoon falling asleep in front of the telly?
Thank you very much. Susan, you'd like to answer that one?
It's really difficult to answer that question directly because it depends. You have to put lots of different things together. But what we do know is that for people to become ill, they need a certain dose of the virus. So the longer you are with somebody who is infected, the more likely you are to get sufficient dose to make you ill. The nearer you are, the more likely you are to. The more you're in an unventilated room, the more likely you are to. So I think what is going to be really important, since the government hasn't helped with giving the guidance that was needed to keep people safe this Christmas, is I think everybody just needs to take these basic, simple principles and work out for themselves, if they are going to see somebody, what am I going to do to keep that person safe? The other thing to think about is the vulnerability of the other person in terms of their age, their gender, their ethnic group, the extent to which they might have other underlying conditions, and also think about yourself. Or anybody else in contact with those people. Have you been isolating? How many people have you been in touch with who in turn could be infected? So it's about taking those things into consideration together and managing risk as best as we can.
It is a massive personal responsibility, isn't it? Kit Yates, you'd like to comment here?
I think it's probably fair to say there is no safe level of mixing. Nothing is safe. There are degrees of probability of transmission, and we would always order it in the sense that the safest thing to do is to actually meet online, not in person. If you are going to meet in person, then meet outdoors, socially distance. If you want to meet indoors, then we'll emphasize that you should ventilate, you should try and wear masks, you should socially distance indoors, you should keep the windows open. And try to do it for a shorter period of time as possible, because as Susan suggests, the longer you meet up, the higher the probability of infection. So those would be the sort of order which we should suggest. But if you can avoid meeting up in person, then that's what we would always suggest doing.
Thank you very much, Kit. Talking about those indoor interactions, I mean, we know that you might have meetings with people indoors and may escape with no transmission. But we know that if everybody is having those meetings indoors, there will be transmission, and it could be you. So it's very, very difficult, and it does require people to think really seriously about the risks individually and as families. So we're moving on now to the next question, unless there's anybody else who has a dying urge to comment here. So David.
If I could just quickly come in and say, you mentioned meeting Granny for only an hour. And I would say that's probably the most dangerous thing. So meeting grannies and granddads is what we all do over Christmas, of course. And you're putting these older people, their lives at risk. It just seems such a terrible thing to do, to have a big hug with Granny when you've been dying to do so and she's been dying to do so. And then she ends up in hospital and possibly dies. So I think that we just have to really understand Christmas is a time of intergenerational meetings, and that's why we should really cut it right back.
Thank you very much, Sir David. Moving on now to another question from the press, and it's Robert Peston, ITV. Robert.
Hello. As you pointed out, infections are rising more or less everywhere, in some places alarmingly. I'm interested to know whether you think that the tiers have, is it because the tiers have been wrongly calibrated, or is the whole concept of tiering, in your view, mistaken? And if it is, what would be a preferable alternative?
Thank you very much for that question, Robert. Kit, I was going to start with you anyway. Thank you.
So I think the tiers at the moment are clearly not enough. Tier 2 is not enough to do anything almost anywhere. Tier 3 is enough to bring cases down in some regions, but not in others. Obviously, there's heterogeneity, there's differences between different regions in terms of their population density or their demographics, which change how people mix with each other. And so one rule isn't going to be sufficient to bring cases down in every single region. I think there are other reasons why cases might be rising, particularly at the moment. I think the vaccine coming online has meant people perhaps have relaxed a little bit and have decided to let their guard down because they can see this light at the end of the tunnel. And I think the government's messaging around Christmas suggesting that it's okay to meet up has meant that a lot of people have relaxed, let their guard down early, and potentially we've seen lots of people in crowded shopping streets, and this is clearly not going to help matters. So I think at the moment the tiers are just not tight enough, as well as having schools open, as well as having outdoor mixing with people. But that's not to say that they won't be good enough in a different situation. But people also need to think about the way that they're behaving and thinking about whether they're taking responsibility for themselves and their loved ones and their community.
Thank you very much, Kit. Would anybody else? Yes, Professor Gabriel Scally. Do you think the tiers are working?
Well, it's a good question, and the answer is no, and they never would work by themselves. That's just an impossibility. Any infectious disease, Robert, requires a range of responses, and certainly social restriction is one of them. But this government is a one-trick pony. All it knows is these tiers, and that's their response. And they haven't addressed the other issues. The failure of the test and trace system, which has been going on for so long. And if we'd one plea, I think, over whatever period of lockdown happens after Christmas, because there will be one, it is, please let us get that system fixed, the test and trace, because we are going to get more outbreaks. And as vaccination helps people all over the place, we will see localized outbreaks continuing. And we absolutely need that local public health response to be as strong as possible. So getting that fixed is one thing. The government abandoned the 2-meter distancing rule, if you remember the distance passed when they went to 1 meter or 1 meter plus. I haven't heard 1 meter plus mentioned for a very long time now. I doubt if many people remember what 1 meter plus was. And we've called on the government to bring that 2-meter rule back, because I don't see 2 meters being observed when I'm on the occasions I'm out going to the shops or whatever. It certainly isn't observed. There's a failure about ventilation. We discussed that in terms of school, but I think in general, the government should be putting substantial amounts of money in improving ventilation in not just schools, but helping workplaces become safer, helping retail places become safe. All of that needs to happen. And finally, the one thing not talked about at Christmas, amazingly, because Christmas is a major travel time, we know that, and there will be people arriving at ports and airports across this country, and we have a miserably bad, ineffective isolation system in place at our ports and airports. And it should be a managed isolation system, and the countries in the world that have got the virus under control have that in place. So in summary, the government has put all its eggs in one basket, and those eggs are breaking, and the country is suffering as a result.
Thank you very much, Gabriel. Professor Anthony Costello, how do you feel about the tier system?
Well, I just wanted to endorse what Gabriel's just said. And I want to ask Robert, he's got a lot of power. He can address questions to the Prime Minister and advisors. Has he ever asked a question about the lamentable level of support that paid to people to isolate, well below minimum wage, why that hasn't been increased? Why are the figures so low in Liverpool? Why are the poorest people avoiding getting tested because they can't afford to isolate? And why is he not asking questions about Serco and all these private companies that have manifestly failed with the tracing system? Tracing is based on trust. People will listen to doctors, to public health people. They're not going to listen to people that phone in from call as it's failed. Why aren't they asking questions about this of the government? That's my question back to Robert.
Okay, well, can I pick up? Am I allowed to respond or not?
You are allowed to respond briefly, yes.
So, Anthony, yeah, of course I've asked about the whole issue of inadequate, as many people see it, financial support, particularly for poorer people when they're forced to isolate. This is something, people like me bang on about all the time, both in public and private. And equally, we've, consistently raised questions about Serco. I think the more interesting question is, why, despite the fact these are not unknown problems, I mean, the interesting question is actually why Parliament rather than the media is so lame in this respect. We can flag these things up. We do them all the time. But, at the end of the day, we appear to have a government that on many of these issues feels sort of secure enough to sort of bat it all away. I mean, I suppose just going back to this tiers issue, just very, very briefly, for me, the interesting question would be, because it does seem to me that one of the flaws of the tier system is that when you think you are about to go into a higher tier, you basically go out and party because that's the last time that you'll be able to do it. And when you come out of a tier, you sort of celebrate by socializing too much. And my question about the tiering system is broadly whether it's just fun. It's based on a misconceived idea about how people broadly behave, because every time you change tiers, you affect people's behavior. They tend to sort of socialize considerably more. And it seems to be, therefore, when people know the tiers are likely to change, you actually you create an incentive for antisocial socializing, as it were. And that seems to me to be the fundamental issue about whether we'd be better off having a base level of restrictions for the whole country, and then much more locally specific restrictions as and when you see, obviously this requires test and trace to be a slightly more sensitive, to operate in a more sensitive way in identifying areas of hotspots, as it were.
Robert, you've managed to sneak in an extra question there, so I can see that. That's all
I think
right.
I was allowed since Anthony decided that it was Peston question time.
So, as you've snuck in that extra question, Professor Susan Mickey would like to answer it for you.
Well,
Susan.
Two responses. One is a strategic one. What the government has done all the way along is too little, too late, to be on the back foot instead of the front foot. And so the whole tier system is waiting till things are very bad and then slapping on a tier. So that's one issue. We shouldn't be having to have these kind of restrictions, as we've been talking about before. With the tier system, there's a whole degree of confusion because it's not part of a planned strategy. And because the government are not thinking in advance and seeing what's likely to happen and acting to prevent things in the future, they're always responding to what's just around the corner. What we've got are last minute decisions, different things happening in different nations, different things happening even within the same tier in different regions, and changing all the time. And there's good evidence over the last couple of months since the tiers have been brought in that people are feeling much less confident about remembering what it is they're meant to be doing in what circumstances. So the data are not showing that people are generally breaking rules. In fact, the adherence to the rules has kept pretty steady since the summer at really quite a high level. People are, on the whole, wanting to do the right things, but I think really confused about what it is they're meant to be doing. So I don't think the tier system, as it is working at the moment. Too little, too late, and it's obvious about what's going to be happening after Christmas. And when people talk about a lockdown, this last lockdown wasn't a lockdown. Universities were open, schools were open, many shops were open. It was actually very difficult to see that things weren't different apart from pubs and restaurants not being open. So I think there needs to be a really proper set of restrictions, because that's what all the evidence around the world shows is come in early and come in hard get the transmission rate down to a really low level that you can then keep at that low level with a successful test, trace and isolate system.
Thank you very much, Susan. Robert, I'm sorry, I'm going to have to cut you off there because I know that other members of our panel want to respond, and Professor Christina Pargle wants to say something. So Christina, you can speak next.
I just want to say something about the tiers. And it's not that I do agree with what other people have said, but the truth is they have been working somewhere. I mean, national implemented tiers in the Republic of Ireland seem to be working. They're working better in Scotland than they're working here. And something has changed in England. Under looser restrictions in the old tier 2, London and the southeast did not actually go up that much for about 4 weeks in October and early November. So it's not that that they've never worked, or that, you know, and the Northwest was coming down under tier 3. So it's clearly something has changed. I don't know what it is. I don't know whether it's a combination of behavior and use of the vaccine, temperature, Christmas shopping, knowing that Christmas is coming, all of those things mixed together. But there is something going on, because I am actually surprised by how badly the new tiers are working, given they're stricter than the old tiers.
Thanks very much, Christina. And Stephen, you would like a brief comment here. Please keep it brief.
Well, it's a theme that Susan started with, which is the relationship between what we say and the SAGE structures say. And a lot of the time we're saying the same thing, and it's not only us who are being ignored, but the government's own advisors. And early on, SPI-B put out a very good paper, and the point it made was an approach to local measures which is punitive, and which is about only restrictions, is not going to work. Because the point is, you have spikes in infection generally in places where people are more exposed, and they're more exposed because they're more deprived. And therefore, we should be thinking much more in terms of how can we support those people, support them with better testing, support them with better information, and support them financially and with resources, both for individuals to self-isolate and for the small businesses who are going to suffer. And the struggle over tiers isn't about the measures, it's imposing the measures without the support. So if we reconceptualize them, less as lockdown, less as something punitive, but how can we help those people who are more exposed, I think the political debate and the behaviors would be entirely different. So the whole point is, and it's a point from SPI-B, and it's a point from us, that the government ought to be thinking more in terms of support, less in terms of restricting people and then wagging its finger at them and threatening with punishment when things go wrong.
Thank you very much, Stephen. Robert, I hope that's answered your both your questions. Moving on to the next one now, it comes from Dr. Tony O'Sullivan. He is a retired paediatrician and co-chair of Keep Our NHS Public. Tony, are you there?
I am. Thank you very much for inviting me. And another huge thank you to all of you for your integrity and hugely important messaging. I hope the vaccination programme stays in public hands, although essential funding to support that has not been provided by the government. My question is about vaccination. Successful take-up of the vaccines relies heavily on public trust. And I know that only too well. As a community paediatrician, it took over a decade to recover from the damage done with the Andrew Wakefield scare about autism and MMR. There is, of course, a moral argument against private contracts in healthcare and in public health, which I share, declaration of interest. But could independent SAGE say what you think is the impact of government actions contracting other essential public health measures to their close private business contracts, as described by the National Audit Office recently? What impact does that have on public confidence in the vaccination programme? Thank you.
Thank you very much for that question. Professor Martin McKee, I'll come to you first and then Anthony to you.
Because I will have to go immediately after this. But we wrote a paper, Tim Lang and I wrote a paper back in 1996, I think, about BSE, where we said at that stage, frankly, the government at the time was not telling the truth. It was undermining trust. And whenever it did tell the truth, then nobody would believe it. And that was exactly what happened with MMR. What we have learned from this throughout the pandemic is that political leaders who are trusted lead countries that develop effective responses. Trust is absolutely fundamental, and it's not separable. You can't be trustworthy in one area and untrustworthy in another area. We know in England, the Dominic Cummings affair had a huge impact on public trust. And exactly as you have said, the National Audit Office report was absolutely scathing. The New York Times article the other day on procurement, which unfortunately, and I don't know if Robert's still listening, has got far too little traction in this country. It's ridiculous that it's the New York Times that's pushing on that. These are really, really problematic, and we really need to demand better of our political leaders.
Thank you very much, Martin. Anthony.
Well, just to endorse what Martin said, and that the New York Times article that was published yesterday or the day before showed that $22 billion, or maybe pounds actually, have been spent, and half of it had gone to favoured, politically connected contractors. And there was a tenfold difference between those people that asked to be included in the procurement schemes and those who were politically connected. There is a close relationship, as many economists have written, between trust and corruption. And I'm not going to say much more. There is the Good Law Project looking at these contracts. Half of them have not been actually released yet. And if there has been corruption and unfair dealing, this needs to be looked at most seriously, because it is totally undermining our trust, and why they're avoiding investing in the NHS for test and trace, where public health people are manifestly doing twice as well as any of their contracted companies. It's truly shocking, and it does undermine both our NHS, the vaccination program, and as Tony has described, that's shocking in my view.
Thank you very much, Anthony. Now, I know that there were a couple of others that wanted to get in on that question, but I'm afraid we're running short of time, so I'm going to move on to the next question. But hopefully you'll be able to perhaps weave in your answers into answers to this next question. It comes from Lucy Watson from London. Lucy.
Hello. My question is that, we've painted a really bleak picture for the next couple of months. But, Christmas and New Year is traditionally a time when we not only look back, but we also think forward to the forthcoming year. And, we know we've got this fabulous vaccine coming, which is tremendously successful. We know, we've got to make some assumptions. I guess at the moment we give people the benefit of the doubt about how successfully that's going to be rolled out. But, what can we expect as 2021 progresses? Can we dare to look forward to getting on a plane next summer to go on holiday? Are we going to be, is alternate sage going to be still talking about this as we go into autumn next year? We've had some hints that things aren't going to just automatically return to normality, but I don't have a picture of what that looks like. And I don't want to put you on the spot, because I know you don't want to be the purveyors of bad news, but what could we expect for 2021?
Thank you very much, Lucy. And you're asking us to do a bit of crystal ball gazing here, but Professor Deenan Pillay is prepared to have a go. Deenan.
Thanks. Thanks, Lucy. Inevitably, there's going to be long-term consequences of what we're living through at the moment of pandemic. And it requires leadership that can express that in a way where people can imagine what their lives can be, possibly without kissing each other and hugging whenever we meet people, possibly without handshaking, but nevertheless with less pollution, a greener economy, and so forth. There's real positives that can come out of this, but this depends on political leadership, and it depends on transparency. And just relating that back to our previous question. Yes, there's what's called the chumocracy of people giving contracts to each other. But I think a more fundamental problem within the UK at the moment is the essential requirements to imagine that future of how we can live productively together, is that the whole of our public health infrastructure has disappeared. So, during the last During the last 6 months, we've had a decision to disband the Public Health England and replace it with something called National Institute of Health Protection. Yet at the moment, I don't think anyone can say whether Public Health England exists. Their chief executive is now moved on to another job. I don't know whether National Institute of Health Protection exists. There's been no formal appointment, a transparent appointment. There's a joint biosecurity centre, which is meant to take on some functions of Public Health England, yet it's very unclear about that. There's a story doing the rounds today of another industry person that's been appointed to lead the testing component of Test and Trace, taking over from the previous chief exec of Sainsbury's in that role. Again, accountability is nowhere to be seen. I don't know if anyone else on the call knows, what the accountability of these different organizations are. And without that, I fear, and with a government that, of course, cannot be straight with us. The government, Boris Johnson and the like, can only hype up some when we finish, talking about the end of the pandemic, we'll all back to normal. I do think we need to start discussing what the future looks like in a positive way, but in a way that can ensure that we're protected from this infection and future pandemics in the future. Thanks.
Thank you very much, Dean. And Professor Carl Friston, I know that you'd like to comment here, and then I'll come to you, Tallulah. Carl.
The question feels like an invite to say something with Christmas cheer in it. And I'd like to do that. But first of all, just to qualify that by saying that there is a danger that they think it's all over. And it certainly is not. So all the evidence that we have at hand is that there is a long slog ahead where things will fluctuate over weeks and months, not days and weeks. So I think the question about will things return to some degree of normality by next summer is about the right time frame. Things are only going to change very, very slowly. But there's one thing which I find quite hopeful, is that the vaccination may be more effective or work more quickly than it would otherwise normally do. And that's due to the effective herd immunity that we might aspire to with a vigorous vaccination program. If it's the case, so the herd immunity threshold is 1 minus 1 over the reproduction rate. So we need usually to vaccinate 60% of the population. But if we already have a certain degree of pre-existing immunity plus an acquired immunity, given our experiences so far, we're actually in a slightly more comfortable position, which means the effective number of people that we might have to inoculate may be slightly less, which means that we may attain a degree of population immunity slightly more sooner than one might imagine, for example, by next Christmas.
Thank you very much, Carl. And Tallulah, I'm going to come to you now, but I also wondered if what your perspective was on returning to normality, because one thing that this pandemic has done has really, really shown us the deep inequality that exists in Britain. And what do we want normality to be in the future, Tallulah?
Yeah, right, exactly. So 2 points on that. The first is exactly that, is reflecting on the, hold on, sorry, 2 seconds.
I'll come back to you on that, Tallulah. I will now invite the last question, but I would like to come back to you.
Okay, sorry.
Are you ready?
Sorry, I'm back.
Okay.
Yes. Sorry, I had a delivery and some noise. So the reality of reflecting on the fact that normal was not okay to start off with is really an important thing to reflect on. You mentioned Christmas as a time for cheer and getting together. It's also a time when we conventionally reflect beyond ourselves and even beyond our households to the condition that others live in. So it's often a time of charitable giving and reflecting on the experiences of others that are less than optimal. And so I would hope that this Christmas, rather than just talking about what we can do, what our households could do, that we use that time to also reflect on the, to be honest, fairly unjust rather aspects of society that we have condoned directly or indirectly up until now, and see the opportunity, recognizing that we can make those changes to do so. I read somewhere to end off with that hope is informed optimism. So beyond just talking about hope, can we reflect on what we know and learn from what we know, and have the optimism be informed by tailoring the ways that we reset to address those inequalities? And if we do so, then I am hopeful.
Thank you very much, Tallulah, for that note, very much needed note of hope and a responsibility that comes with it. And we're moving on now to our final question, which comes from Vicky Zentner in London. Vicky.
Hello.
Hello. What's your question?
Have I got my video? Yes.
Yes. Hi.
So thank you for taking my question, and thank you so much for everyone's exceedingly sage advice. I wondered whether Indie Sage members will be taking advantage of the government's relaxing of the restrictions, which will allow 3 households to celebrate Christmas together, or if you'll be postponing your get-togethers till some point in the future.
Who wants to go first? Kit, you've got your hand up.
So I have 2 young kids, 5 and 7, in school. So they've just finished school today. So there's been no opportunity for us to self-isolate. I also have an 80-year-old dad and a 77-year-old stepmom. And so we've taken the decision not to see them, even though it's legally allowed. I would hate to think what would happen if I went up there and afterwards they contracted the virus and got seriously ill or potentially died from it. For me, the risk is just too great with what I've seen from the data, with cases rising all around the country. The risk is just too high for me. So this is a decision I've taken in conjunction with my dad and my stepmom. We've talked about it, and they didn't want to see anyone this Christmas. It's not sensible. And what we'd love to do is to meet up when they've been vaccinated and when case levels are much lower in the community. Possibly we could try and put pressure on the government to give us a public holiday in the summer so everyone can celebrate at the same time. That's what I'd really like to see. But for this Christmas, we're gonna meet online and play it safe.
Thank you very much, Kit. Anybody else want to share their Christmas plans? Certainly I'm battening down the hatches and I'm staying at home with my husband and my 2 kids. Susan.
Well, all my life I've spent Christmas with my sister and her family. So this will be the first year that we don't share a meal. But what we're going to do is meet together before lunch on the pavement and drink some champagne together. So be outside, not for very long, socially distanced, but it'll be lovely anyway.
Excellent. And the risk is so much lower outside if you can do that. Anybody else? What are you doing for Christmas, everybody? Being careful. Deenan.
Well, we're all in different situations. I have a 95-year-old mother who is really, had a wonderful life, but now has a number of morbidities and is very likely this is her last Christmas. And although we're not fixated on Christmas, I'll probably take some food over to her with her carer and be very careful about how long we spend indoors and so forth, and the other side, eating at the other sides of the room. But that's a response. Again, we're all in individual circumstances, but it is really clearly trying to minimize any obvious risk, taking account of all of our different circumstances and people, and particularly elderly relatives who are all in different situations.
Thank you very much, Deenan. Christina.
So what we're doing, so both my parents are clinically extremely vulnerable, but my mum is basically also carer for my dad, and so I think for her it's been really lonely because they're technically 2 people. Well, they are 2 people. She hasn't been able to bubble with anyone either. But so my husband and I have been isolating since the weekend. We don't have kids. We're planning on hopefully going around there on Christmas Eve, which will be 11 days in. Windows open, cook dinner, a few hours, go home. And then my sister, who has 3 teenage kids, is not going to see them inside at all. They normally spend the whole Christmas period with them. So that's quite a big change. And we're planning a walk at some point outside. But that's And then that's kind of what we're doing.
Thank you. Zubaida.
I was going to say it is so difficult this year. So I'm not going to be seeing my mum because my mum's in another city. My mum's extremely vulnerable and I miss my mum like crazy, and my mum really wants to see me, so that's not going to happen. And here's my dilemma. So we were supposed to have my 82-year-old neighbor over, and she desperately wants to be over. You know, she loves being with us. She's not going anywhere, and every year she goes to someone else's. And we're just in a really difficult position where, you know, I've got 2 teenage kids. I don't think it's safe for her. I think she's feeling wobbly. And, you know, we would have obviously thought to open all the doors, perhaps even have Christmas dinner in the garden. And that's still a strong possibility. But it's a really difficult one. And we are now erring on the side of maybe it's not a good idea, or best case scenario, coats on, doors wide open for the garden and have it that way.
Thank you, Zubaida. Anybody else? These are such difficult decisions, aren't they? You know, we're missing people and we've missed them for a long time. Gabriel, were you?
Well, there'll be 3 of us in the house and we're not planning to mix with anyone else. We'll see one of my daughters who lives only a few hundred yards away in the garden or outside somewhere. And even though Bristol, where I live, has miraculously moved from tier 3 to tier 2, we will not be frequenting pubs or restaurants or taking advantage of any of those dangerous liberties that have been granted to us. Because we've gone through so much this year, it would be so wrong to risk anything at this point in time. It would be just so wrong. I couldn't possibly bring myself to do it.
Carl, what are you up to?
Well, I just wanted to. What Gabriel just said is exactly what my father said to me. So he doesn't want to see me. He said, I've put so much into this self-isolation for 9 months, and I don't want you coming up and giving me a virus. Endearing, but very rigorous. So I shall spend the Christmas in my conservatory, smoking my pipe with the windows open.
Thank you very much, Carl. Don't ruin it now. I mean, that's the message, isn't it? You know, we have all gone through a lot this year and missed seeing people, but we can see that there's light at the end of the tunnel. We can see that things are going to change and that we will be back in that position where we can see our loved ones again in the way that we wish to. Tallulah, would you like the last word on that?
Oh, goodness. I wasn't expecting that. I was just going to add before what informed my decision was something that we often forget, and I don't see mentioned in the conversations about this, which is that we have to remember that if you have the virus, you're contagious a couple of days before, at least before symptoms develop. So for me, I have chosen at some point over the Christmas period, I will meet my parents in the park, go for a walk near them and mainly be outside, because I can't guarantee that just because I don't have symptoms when I see them, that I'm not infectious. And to be honest, I go for runs a lot, and sometimes I'm very close to people, and there's a really bad cough etiquette around me, and I'm just paranoid about being too close to people going through a tunnel who have not. So because of that, I'm seeing them outside. So I think it's just something to remember, that just because you're not sick or symptoms today, that you're not contagious.
Thank you very much. And we have run out of time, so I'm going to draw it to a close for today, for this year. And before I wrap up completely, I'd like to invite Sir David King to sum up as usual. Sir David. You're on mute, Sir David.
I'm simply going to wish everyone a happy Christmas, despite the rather gloomy prospect that we've all been putting forward. I haven't commented on my own situation. I have my youngest son, who lives with his partner in London and who is known to all members of Indie Sage, is also isolating with his partner for 10 days, and then they hope to come up to Cambridge to see us. But the other members of my family have children, and so they can't do the same. nor can they test before they come up here, which my son, who will come, will. So we'll have a Christmas with him and his partner, which is wonderful. But you know what? We've all got used to Zoom and other forms of meetings. And I've had quite a few evenings celebrating various things with my family and their children with a glass of wine over Zoom. It's the safest way to do it. And I know it's much nicer to be there and to give them hugs, but let's put that off for a little while. Have a great Christmas.
Thank you very much, Sir David. Thank you to all of our panel. Thank you to everyone who's been watching. Thank you for all the fantastic questions today. All the reports that have been published by Independent Sage are there on the website, along with details of the whole team. Do follow us on do follow Independent Sage on Twitter, rather, if you don't already. And it's the first time I've ever said this, but we won't be back same time, same place next Friday. We'll be back on January the 8th. So however you celebrate in midwinter, happy Christmas, happy Hanukkah, Merry Yule, have a good time and stay safe, and please keep well.
We wish you a Merry Christmas. We wish you a Merry Christmas.
We wish you a Merry Christmas and a Happy New Year.
Bye, everyone.
Bye-bye.
Bye.